Why did I even become a nurse? I've had moments where I thought that I never should have went to school for this. Hey cousins, welcome to my channel. I am Courtney Noel. Clearly, I am Courtney Noel. And if you're new to my channel, welcome, welcome, welcome. And if you are an oldie but a goldie, hey girl, hey, hey boy, hey, welcome back to my channel. I know the nurses are burnt out. The nurses are stressed. The nurses do not want to do patient care anymore. And if you find yourself in this predicament, I am here to throw you a life jacket. I am here to throw you a life raft to help you explore different specialties outside of direct patient care. If you find yourself in this predicament, before you leave nursing, before you say forget the whole industry, try one of these specialties. This is part 2 of a 2-part series. If you haven't watched part 1, click the link up here or it'll be in the description box. Go and watch part 1, then come back here for part 2. And these are not really common. I don't see a lot of people posting about it. The first one, or the first video, or this video. So hopefully, let me know in the comments box. Please don't forget to like, comment, subscribe, share with your other nurses. It really is free and it helps to support my channel. But also I want to see you guys. It was a lot of blood, sweat, and tears. I know personally, I'm a nurse, that it was a lot of blood, sweat, and tears put into obtaining this degree, obtaining the licensure. So please don't just leave the profession. Try one of these specialties before you make that alley-oop up out of here. I do want to say, when it comes to these specialties that I provide, a lot of nurses are looking for remote work. Remote work has been extremely hard to obtain. Not impossible, but hard, especially with just the state of the nation, a lot of return to work orders, things of the sort. So remote work is tough to get. You may get a hybrid position, but I'm trying to give you options so that way you don't have to provide straight patient care. Trying to get you away from the bedside at least. And even though you may have a physical place to report to work, you don't have to be the one giving the direct care. So hopefully it helps. First up is infection control and infection prevention. These nurses work double time, triple time during COVID. They basically implement different strategies to reduce infection. Of course, with COVID, they played a big role of tracking, figuring out what's good, implementing the evidence-based practices that were coming out in regards to the disease. They do a lot of clustering. These ladies do a lot of work, especially if your facility has different issues with nosocomial, I don't know if they call it here, but you know, hospital-acquired infections, hand hygiene, things of the sort. So these nurses, I'm sorry if I said ladies, but these nurses, their average salary ranges from around $75,000 to $112,000, depending on where you live and your experience. This is a really cool lane to be in. I mean, other than COVID, they're really like a lot of statisticians. They're really in contact with CDC. I believe one nurse who does this, and it's very interesting to see that their work, and that's something, you know, you should explore if that piques your interest, especially if you're into like microbiology and things of that sort when you were in nursing or getting prepared for nursing school. Side note, I have been a nurse for 16 years now, and I have a lot of friends in the profession. Let me know in the comment box if you would like for me to interview some of the nurses in these different specialties, because I do know quite a few of these, you know, people in these specialties. And let me know if you want me to have a sit-down interview with any of these nurses to help you understand their day-to-day, this and that. Drop a comment in the comment box below, and if I get enough traction or enough comments, I try to make those happen. Also, let me know what specialties that you're interested in. The second specialty I have on my list is quality management / performance improvement. And these are the nurses that focus on patient safety goals. You know, we all know age caps, those things come out, and there are certain goals that hospitals and healthcare systems must reach. These nurses have different measures and different things that they put in place or help to implement in the system to improve the scores where this is concerned. So if you have a facility that is, you know, having a lot of instances with UTIs, you know, hospital-acquired UTIs, then that is something that they focus on in conjunction with infection control. So a lot of these can coincide and work together, but quality management, and there's also a certification for this. And these quality management roles are, a lot of times they do a lot with Joint Commission. They do a lot with surveys. I know that they moved to the different, I forget what's, you guys dropped the name of the other survey that they're doing. Is it Danby or something like that? But with Joint Commission, the new certifying body, these quality men, they help prepare, they help the system get prepared, the leadership, everything. Quality management, performance improvement, that's their lane. These nurses can make anywhere from 71,000 to 100K, probably more than 100K, depending on where you are, your experience, and how your reputation, how it precedes you as far as getting things in alignment for facilities and systems. And these nurses also can work in a variety of different settings. That kind of goes for all of them, but except for like specialized ones like patient transfer nurses or patient logistics and different other nurses that I've mentioned. But these, they can work in quality management and performance improvement. Nurses can work in different settings. Some work at nursing home or skilled nursing facilities, inpatient rehab facilities, for, home healthcare agencies, healthcare systems, outpatient centers. So these nurses can be plugged and played in different settings. The next specialty that I have is risk management, or a risk manager. So risk manager, it is a high paying non-bedside job, but this could be a high stressful role because this is really a legal kind of role. You're dealing with a lot of root cause analysis. These nurses I've heard they take on call too. So if anything happens at the hospital that could be legally binding, you know, if there's something, any really adverse sentinel events, issues where they're calling the news, this and that, the risk managers deal with that. So this is more of the legalistic lane of nursing. So if you are one who's like, you know, I wanted to be a lawyer, or I like a legal type vibe, if you are always watching Scandal or those different types of shows, then maybe risk management is the avenue for you. I did a little bit of research. Remember, my numbers are they're not tight because you can be anywhere in the country trying to do this, but they say the pay range is anywhere from 83,000 to 114,000, which I think, depending on where you live, where you are, and how good you are at your job, you could command more money, because risk managers are highly sought after, especially if you're really good. But in the role, from what I hear, is very it could be very stressful. Let's talk about nurse navigators. I kind of think nurse navigators are really good roles, or interesting roles, especially if you're coming from the bedside or like a case management bedside role, because these nurses kind of follow their patients through the continuum. They make sure their patients, so if you say, for instance, you work at they have them for all different types of specialties. I've seen them for OB, pain management, neuro, oncology. What I saw one recently for, I think, ortho. So these nurses basically follow the patients through the continuum of care. They make sure that they're seeing their specialists. They're kind of the link that keeps the patients, the doctors, everybody in the loop. They get the test results. They know what's going on with their patients. And if you are a nurse who's like, yeah, I want to leave the bedside, but I still like to have some type of patient interaction, I still want to feel like I'm valuable, useful, nurse navigator might be the lane for you, because they really develop relationships with their patients. I have a friend who does nurse navigator for Cardiac Center of Excellence. She says she loves her job. So, and she comes from the cardiac world. So she develops relationships. She knows her patients by name. They know her, they call her. If you are that type of nurse who likes to do that kind of, you know, networking, talking, and interaction with people, nurse navigator may be the lane for you. Well, guys, I hope this video was informative. Let me know if any of these specialties sound intriguing. Let me know if you are actively in the role of these specialties. I just want to get some feedback, because for me, I thought it was interesting when I started to do research about these. I mean, nursing, your nursing degree can open a lot of doors for you. So don't get caught up. I know it seems so hard right now on those units. You guys, my heart goes out to y'all. Trust me, I have been there. I have had the moments where I consider, like, why did I even become a nurse? I've had moments where I thought that I never should have went to school for this. after I have completed everything. But it does get better when you find your lane. And I think that this is important to know. As far as me, I have worked in a lot of different settings, and once I found what was appropriate for me, I've been able to just stay in place or stay within that specialty. And that can happen for you too. It just takes a minute, but be relentless in finding it. Like, I was relentless. I'm not gonna even lie. I was relentless in finding my lane, because if not, I would be doing something totally different. And I don't want that for you. I want you to find your lane, so that way we can retain our nurses, because we need y'all. Like, we need y'all. We want y'all to be healthy. And I'm a nurse talking to you as a nurse, or someone who wants to be a nurse. We need y'all in this profession. This profession is a wonderful profession. But as I always say, use nursing. Do not let it use you. God bless you. I love you, but Jesus loves you more. God bless you.